If you are studying for the CDA exam and you don't know these 10 questions, what are you even studying? There are 10 must-know questions for the DANB General Chairside exam, plus an exam tip that goes with each of them so you understand exactly why the answer is the way it is. But before we do so, be sure to hit the like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it!
Question 1. What is the proper way to transfer a sharp instrument during a procedure? The answer, the transfer zone, which is the area over the patient's chest between 4 and 8 o'clock. Sharp instruments are passed so the working end is directed away from the operator's hand and the dentist never has to reach or look away from the treatment site. Exam tip. The DANB loves to test instrument transfer safety. If the answer choice includes anything about passing over the patient's face, that's always wrong. Question 2. What does the term ergonomics refer to in dentistry? The answer, designing the work environment to reduce physical strain on the dental team. Things like operator positioning, stool height, and instrument reach. Exam tip. Ergonomics questions on the CDA often focus on clock positions. The operator typically works between 8 and 12 o'clock depending on right or left-handedness. The assistant between 2 and 4 o'clock. Question 3. What is the purpose of a rubber dam? The answer, to isolate the treatment area, keep the field dry, protect the patient from swallowing debris, and improve visibility for the operator. Exam tip. The exam may ask about rubber dam clamp placement. Clamps go on the anchor tooth, which is usually 1 or 2 teeth distal to the working tooth. Question 4. What is the difference between supragingival and subgingival calculus? The answer, supragingival calculus forms above the gum line and is typically white, creamy yellow, or gray, while subgingival calculus forms below the gum line and is dark brown, dark green, or black due to blood pigments. Exam tip. The CDA will test you on the color difference. Subgingival equals dark. That detail alone can lock in a correct answer. Question 5. What trace setup would you prepare for a composite restoration? The answer, composite resin, bonding agent, acid etch, curing light, matrix band, and finishing instruments. Exam tip. Know your trace setups by procedure type. The exam often gives you a list of instruments and asks which procedure they belong to, or gives you a procedure and asks what's missing. Question 6. What does OSHA require regarding exposure to bloodborne pathogens? The answer, employers must provide PPE, offer the hepatitis B vaccine, conduct annual training, and have a written exposure control plan. Exam tip. The CDA loves OSHA and CDC crossover questions. OSHA equals legal requirements, while CDC equals recommendations. That distinction matters on the exam. Question 7. What is the role of the dental assistant during a local anesthesia injection? The answer, the DA prepares and transfers the syringe, monitors the patient, and documents the anesthetic used, but does not administer the injection unless working in a state that permits it with expanded functions. Exam tip. Expanded functions vary by state, and the DANB knows this. If a question asks what a DA may do, look for language about state law or supervision level. Question 8. What is a gingival retraction cord used for? The answer, to temporarily push the gingival tissue away from the tooth to expose the margin for an impression. Exam tip. Retraction cord questions often come with crown and bridge procedures. Note that it's placed before the final impression, and some cords are impregnated with a hemostatic agent to control bleeding. Question 9. What is the purpose of cavity varnish? The answer, to seal the dentin tubules and reduce sensitivity before placing a restoration, typically used under amalgam. Exam tip. Cavity varnish is not used under composite resin because it interferes with bonding. That's a classic CDA trick question. Final question number 10. How should a dental assistant respond to a patient going into anaphylactic shock? The answer, stop the procedure, administer epinephrine from the emergency kit immediately, call 911, position the patient supine, and monitor vital signs until EMS arrives. Exam tip. Epinephrine is always the priority. don't wait on it.
All right, y'all, those are the 10 must-know questions for the CDA exam. If you found this video helpful, go ahead and save it so you can come back to it before exam day. Then share with a DA bestie that's also preparing for the test that you want to see win. But don't forget to like and subscribe, and I will see you both at the next study session. Bye.
The DA Study Spot, yeah.